I'm Dr. Meryl Govender, and I am a Haematopathology Registrar in the Haematology Department at Albert Luthuli Hospital at UKZN. So my journey started about 3 years ago. I was firstly employed as a medical officer in the Haematology Department, and my journey started pretty much in the clinical setting, and where I developed I developed an interest in research when I came into the clinical field of hematology. So I had a patient that had come into my office who was a young 20-year-old female with a large mass on the neck. And she was also HIV positive, but she looked very teary-eyed and she was very nervous and apprehensive when she came into my consulting room. And then she said to me, "Doctor, am I going to die from this cancer?" And I said to her, so I looked at the notes and I saw that she had something called Hodgkin lymphoma. And then I realized that it's a potentially curable lymphoma. So I said to her, "Dear, this has quite a good prognosis." And we got talking, and then she asked me, "So how many patients that you've seen so far have actually recovered or actually been cured from Hodgkin's?" And that's where I was stumped. And I didn't actually know what to say because there was no research that was conducted in our department. And that is where that's what sparked off the research interest in me. So I've decided to ask our HOD whether anything has been done on Hodgkin's, and she said no. And so I therefore decided to embark on this research project where I looked at HIV positive and HIV individuals with Hodgkin lymphoma, and I wanted to look at their overall survival. So how many of them survived in a 5-year period. And I also looked at the clinical profile. So what makes the HIV positive patient different from the HIV negative patient, if any differences are there. And I think that's where my research interest lied, and I was very excited to start on it. And I've already completed my manuscript and it's ready for publication. And I've already looked at a journal that I'm interested in publishing it in, which is called Leukemia Research. And it has an impact factor of 2.1, if I'm not mistaken. So I'm very excited to publish my research findings. And what I actually found, that there is no difference in the survival between HIV positive and HIV negative patients with Hodgkin's lymphoma. And I'm very excited to let that actually be released to be peer reviewed firstly. In terms of my job as a hematopathologist in this department, well, it comprises mainly, as you can see, the microscopes around me. It's a lot of, pathology. We're looking at bone marrows most of the time and the peripheral blood smears. Lots of interesting cases in KZN. It's a great teaching department. We have excellent consultants who are so willing to assist us every step of the way. We have an excellent teaching program. In fact, I've just completed a cytogenetics and molecular rotation, which I was so impressed with. The teaching was fantastic. It was such a structured teaching environment. And I've covered all the necessary basics for my Part 1 examination. And I feel that the department has done great justice to me in preparing me for my Part 1 examination. And I'm really excited about actually attempting the Part 1s.